Puffy bags under eyes after having gotten Asian blepharoplasty? Hi, I am a 20-year-old Asian woman who received double eyelid surgery 2 years ago. Only after my surgery, I developed severe eye bags that are more prominent when I am smiling, squinting, but nevertheless visible even when my face is relaxed. They are not due to lack of sleep or stress, and they cannot be covered with heavy makeup. Are these bags the result of hormones, or perhaps due to a mistake or natural side effect of the surgery? What surgery would I need to get rid of them? Thanks.
Thank you for your question. You're 20 years old, you've submitted several very good photos, and you state in your question that 2 years prior you underwent Asian eyelid surgery, and that you've been aware of puffiness under your eyes subsequent to that procedure. And you want to know essentially is the puffiness related to hormones? Is it related to the original surgery that you underwent? And what is the solution? Well, I can certainly share with you my approach to this type of question when it comes up in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I specialize, among several things, in Asian eyelid surgery. I'm quite familiar with the type of surgery you probably underwent 2 years ago. And I deal with under-eye bags all day long in our practice. So I will certainly give you just basically the simplest, straightforward understanding. And what you are dealing with these under-eye bags, especially as you described when you smile and squint, is bulges of fat. And this is often referred to technically as herniated fat. It's fat that's normally around the eyes that pushes forward and creates these bulges. Now, as far as the cause, generally it is something that I see as a genetic trait that is often seen in families. It is not likely in any way to be the result of upper eyelid surgery. Anatomically speaking, it simply doesn't make sense. If you're working on the upper eyelid, there was no trauma or any type of procedure on the lower eyelid that could have caused some change anatomically in the lower eyelid. So at least you can not worry that the upper eyelid surgery had something to do with this. Now, whether hormones or other factors play a role in the expression of fat, that's a question that is not likely to be an issue in your case unless you have any issues related to thyroid disease. There is something called thyroid-related immune orbitopathy or Graves' disease, but it's not likely to be the case in your situation based on the appearance in the photos. If you have a concern about hormone levels and this type of situation, maybe with the thyroid, since no other history is indicative, meet with a doctor and ask about this, because it is important that you do diagnose any type of hormonal issue before moving forward with the solution related to the under-eye bags. Now, as far as under-eye bags are concerned, you basically have two options, and I would probably lean towards a more definitive option, but I can explain to you how I make that decision. When someone has mild under-eye bags, what we do is we can actually blend the appearance of the under-eye bag with the adjacent area called the tear trough. We do that with injectable filler. We use a material called hyaluronic acid, or in the trade name Restylane or Juvederm, to fill that tear trough area. In some situations, we'll also use something called platelet-rich plasma to help the skin quality and further improve the shadow if there's any issue with dark skin, or I should say skin that looks like dark circles, and that darkening makes the under eye area look even more undesirable. So in those situations, you have injectables as an option. Injectables do need to be repeated, so that's part of that choice. Just with the first impression with your photos, I would most likely recommend something called a transconjunctival blepharoplasty. It's similar in a way to the upper eyelid surgery that you had in the past, with the exception that it doesn't involve any incision. This is a procedure where what we do is from the inside of the eyelid under local anesthesia with light sedation. No general anesthesia. And what we're doing is essentially selectively sculpting, reducing, repositioning the fat that's under the eyes that is pushed forward so that the pockets are diminished and the under eye bags look better. The appeal particularly for this approach is that it's a definitive procedure. Once it's done, you don't have to do anything necessarily to maintain unless you need something for your skin, but you're only 20 years old, so I don't think that that's necessarily an issue unless you have a lot of sun exposure or you smoke or other issues related to skin. That's a different issue, a different topic altogether. Essentially, you're dealing with this fat prolapse, and you may want to meet with a doctor and now discuss this option as to how to more definitively treat this area. But understanding that it wasn't related to the surgery, and if there's a question about hormones or other health issues, meet with a doctor and have that checked out. So I hope that was helpful. I wish you the best of luck. Thank you for your question.